Bahia. Today I'm going to present Hospital CME in conjunction with World Sepsis Day on the 13th of September. So as we know, sepsis is a global health crisis and is a medical emergency as well. So our title today is Serial Killer. What is 3R? 3R stands for recognize the sepsis early, resuscitate early, and refer to the respective team physician, for example, physician, surgeon, or specialist or consultant to manage the sepsis early. And if there is organ failure, then refer to ICU care. So the overview of my presentation is epidemiology, definition, screening and recognition of sepsis, and prevention of sepsis. So before I go to the presentation, I would like to play a video regarding the sepsis.
4 seconds, somebody dies of sepsis. Sepsis is an emergency. Sepsis is the final common pathway to death from the vast majority of infectious diseases worldwide. It arises when, in combating the infection, the immune system damages a person's own tissues and organs. This can lead to organ failure and ultimately death. Most infections can lead to sepsis. Among them are common infections such as pneumonia, urinary infections, infections in the abdomen, skin or wound infections, or meningitis. Seasonal flu, malaria, dengue and yellow fever, and Ebola may all result in sepsis. More than 80% of infections leading to sepsis are contracted outside of a hospital. Anyone can get sepsis. People with a weakened immune system are especially at risk. This includes adults over 60, young children under 1, people with chronic disease of the lung, liver, or heart, people with diabetes or AIDS, and people without a spleen. But sepsis can be prevented. The easiest way to prevent sepsis is preventing infection in the first place, which can be done through vaccination and basic hygiene. If an infection has led to sepsis, it must be recognized quickly, and the source of the infection treated with antibiotics. Early treatment of infections and early recognition of sepsis saves lives. Sepsis can be detected by symptoms like slurred speech or confusion, extreme shivering, muscle pain, fever, passing no urine all day, severe breathlessness, feeling like you're going to die, skin mottled or discolored. Sepsis is the most preventable cause of death worldwide. It affects 27 to 30 million people a year. 6 to 9 million die. Many survivors face long-term consequences, such as loss of digits or limbs, poor memory and concentration, or post-traumatic stress disorder. It can be prevented by vaccination, sanitation measures, such as access to clean healthcare facilities, and clean water, clean delivery, and, above all, awareness. You can help end the sepsis crisis. Tell your loved ones. Participate in World Sepsis Day on September 13th every year. Donate to support us in raising awareness, prevention, and research. While you were watching this video, 55 people died of sepsis. Sepsis is an emergency. The more people know about sepsis, the safer everyone is. Stop sepsis. Save lives.
Okay, I think the video has delivered a clear message regarding what is sepsis, and now we go to the epidemiology of the sepsis. So sepsis is a global burden. Around 27 to 30 million people per year develop sepsis. So 19 million people will survive per year. However, the survivor may face lifelong complications, for example, limbs amputation, depression, post-traumatic stress disorder, and the other 8 million of people will die per year. So around 6 million neonates and children under 5 will die of sepsis. Another thing, sepsis is one of the most common cause for maternal mortality as well. So everybody can develop sepsis following an infection, especially those immunocompromised patients, those with chronic diseases, and diabetic patient or patient with malignancy, or pregnant mother and neonates. They are predisposed to sepsis. So, what is the local data for Malaysia Registry of Intensive Care? Sepsis is the most common diagnosis leading to ICU admission in 2016, followed by 2015. Sepsis also is a common diagnosis leading to ICU admission. So sepsis, the mortality for sepsis stay around 50 to 60% and has not improved over the years. As shown in the table here, from 2010, the mortality rate is 59%, and in 2016 it stayed around 52%. So it never improved over the years. So this is the old definition of sepsis. As we know, previously we always definition for sepsis, we always say that sepsis is a systemic response to infection. So infection plus 2 or more criteria of SIRS is sepsis. So what is SIRS? SIRS means temperature more than 38 or less than 36, heart rate more than 90, respiratory rate more than 20, or total height more than 12,000 or less than 4,000. So any 2 criteria is SIRS. And severe sepsis is a sepsis associated with organ dysfunction, hypoperfusion, and hypotension. And septic shock is a sepsis with hypotension despite adequate fluid resuscitation. However, this is the old definition of sepsis. Currently, we have a new definition of sepsis. So since 2016, sepsis known as life-threatening organ dysfunction caused by a dysregulated host response to infection. So sepsis is not simply infection plus 2 or more criteria of SIRS. So it's basically a life-threatening organ dysfunction. So what is organ dysfunction? It means that acute change in total SOFA score more than 2 or more. SOFA is a sequential organ failure assessment. Next slide, I will go into details what is the SOFA score. So there is 2 criteria. There are 2 segment for SOFA. We can divide into Q SOFA or the proper SOFA score. Q SOFA is a quick SOFA criteria that consists of 3 criteria. First is hypotension, systolic blood pressure less than 100 mm/mercury, or altered mental status, or tachypnea with a respiratory rate more than 22. So any score more than 2 or more indicate a poor outcome. So in ICU, actually we use this table for the SOFA score. It consists of 6 components of the organ system. It includes respiratory, we look at the PF ratio. Renal, we look at the creatinine level. Hepatic, we look at the bilirubin. Cardiovascular, we look at the blood pressure and requirement of the inotropes. And hematological, we look at the platelet count. Neurology, we look at a GCS score. So SOFA score 2 or more in a patient with suspected infection is sepsis. So this is another simplified version of the diagram which show that infection plus SOFA score 2 or more indicate sepsis. So this is another table which simplified what I have explained previously. So currently, no more severe sepsis. So if sepsis is a suspected infection plus SOFA score 2 or more. So septic shock is sepsis plus hypotension, which require vasopressor to keep the MAP more than 65 and lactate more than 2 millimole per liter after adequate fluid resuscitation. So this is the 2 main criteria to diagnose septic shock. So now the new sepsis include life-threatening organ dysfunction. but the previous sepsis only include the SARS and the infection. So now we go into screening and recognition of sepsis. So we aim to early recognize the sepsis via formal screening report effort. And sepsis screening is associated with early treatment. So early treatment actually can reduce the mortality for sepsis. So in a study published in Critical Care Medicine in 2015 showed that screening for sepsis are associated with improved patient outcome. So how to diagnose sepsis? So the presentation for sepsis actually can present from non-specific or non-localized symptoms. For example, feeling unwell with a normal temperature to severe multi-organ dysfunction and septic shock. So any patient can in with symptoms of infection, but if the patient no spiking of fever, keep in mind that it may be infection, it may be sepsis as well. Because usually, even though infection associated with fever most of the time, but hypothermia is another sign which carry the worst prognosis. So progression to fulminant disease is determined by magnitude and nature of the infective focus, timing and quality of intervention. Early recognition and treatment of sepsis can reduce the mortality. And of course, include the genetic and acquired predisposition of the patient. If the patient was immunocompromised, there is higher risk to develop septic shock. So spot the sepsis early because early treatment saves the lives. So the following symptoms may indicate sepsis. For example, fever with chills and rigor, altered mental state, difficulty or rapid breathing, low blood pressure or low urine output. So 2 or more symptoms, please come to the hospital. So another thing we need to look into is the source of sepsis. There are many causes of sepsis. The most common source of sepsis is pneumonia, followed by urinary tract infection or intra-abdominal infection of infection of unknown causes, which other than that, we also have the endocarditis or skin or soft tissue infection or catheter-related infection. So we need to look for the source of infections. If there is no focal sign of infection, we need to send off the blood culture, the sputum culture, urine culture, or any peritoneal fluid or pleural fluid to look for the source of infection. So what is the management for sepsis? So of course, initial resuscitation is very important, which include the fluid resuscitation, and then we start the antibiotic and source control. If there is abscess, we need to drain the abscess. If the patient unable to maintain the blood pressure, we need to start the vasopressor early and glucose control. If there is low HB, we need to transfuse the blood. However, the most important that I want to stress here, point here is 1 hour bundle. This 1 hour bundle means we need to complete within 1 hour and begin immediately after we diagnose the sepsis. So we need to measure the lactate level, obtain the blood culture before the antibiotic, administer broad spectrum antibiotic, and begin a rapid administration of the crystalloid 30 ml per kg for hypotension or lactate more than 4, and apply vasopressor if hypotension during or after fluid resuscitation to maintain a MAP more than 65. So as we know, actually sepsis is preventable. Actually, most of the deaths here are preventable by good hygiene, good hand hygiene, vaccination, and of course the public awareness is very important. So actually this is a study published in New England Journal of Medicine in 2009. A 24-year-old man suffered from traumatic spinal cord injury. However, he never had any MRSA infection or colonization. But after the routine surveillance culture, we noted the patient has an MRSA grown from the culture. And what is the cause? So basically, they did an imprint of the healthcare workers' ungloved hand after abdominal examination of the patient. So it grew the MRSA colonization from the culture. So after that, they wash the hand with alcohol foam and get another imprint of the healthcare worker's hand. And this is in the image B, whereby the culture know there is negative of an MRSA infection. So this report mentioned that how important is the hand hygiene among the healthcare workers. So please remember that it's in your hand to prevent the sepsis, especially to all the healthcare workers here. So this is my take-home message for all the audience. Sepsis is a medical emergency and it's a global health crisis as well, because sepsis is a top leading diagnosis to ICU admission. And the mortality of sepsis stay around 50 to 60% and never improve over the years. And early recognition and early resuscitation of sepsis can reduce the mortality, and actually sepsis is preventable. So remember that recognize the sepsis early, resuscitate early, and refer if there is organ failure to the ICU early. So in conjunction with the World Sepsis Day, actually Malaysian Society of Intensive Care organized a sepsis awareness run in Putrajaya on 15th of September. Please come and support us.